minutes to the gentlewoman from New Hampshire, Ms. Shea-Porter.
Gentlewoman from New Hampshire is recognized for 3 minutes.
Thank you, Mr. Speaker. I'd like to thank Chairman Berman and Ranking Member Ross Layton and their staffs for their support and work on this resolution. It's important for the House of Representatives to recognize the devastating toll that pneumonia takes on children around the world, and I'm proud that we are considering this resolution today. Yesterday marked the first annual World Pneumonia Day. Almost 100 global health organizations joined together to bring awareness to this terrible disease. The world's leading killer of children, pneumonia is undernoticed, underfunded, and undertreated. This disease kills 4 million people each year, 2 million of them children. It takes the lives of more children under the age of 5 than measles, malaria, and AIDS combined. Every 15 seconds, a child dies of pneumonia. The horror of this disease is that it is so preventable and treatable. Consider these facts. Studies in developing countries indicate that only 1 in 4 caregivers know the 2 key symptoms of pneumonia, fast and difficult breathing. This leads to pneumonia going untreated, which is deadly. Fewer than 1/3 of the children who develop pneumonia receive the antibiotics they need to fight the illness, even though the antibiotics are available for less than $1. Half the cases of pneumonia that occur could be prevented by ensuring that these children have access to the vaccines they need. Mr. Speaker, these facts paint a bleak picture. Millions of lives are being lost each year when they could be saved. They could be saved by international cooperation to educate and train caregivers. They could be saved if people could just have access to the vaccines and medications they need. My resolution affirms this body's commitment to saving these lives by supporting programs that focus on the protection, prevention, and treatment of pneumonia. It commends the health professionals across the globe who every day work in the world's poorest countries to treat and care for the victims of pneumonia. And it reaffirms the United States' commitment to reducing child mortality. Finally, this resolution recognizes World Pneumonia Day. In doing so, the House of Representatives joins with dozens of global health organizations working to raise the awareness of this disease and to focus resources on protection, prevention, and treatment. Mr. Speaker, I urge my colleagues to encourage international cooperation to combat this disease. Lives can and should be saved. I urge my colleagues to support this resolution. Thank you, and I yield back.